In this video, we'll discuss having both Medicare and Medicaid and how they work together to cover your medical expenses. We'll also talk about extra help with prescription drugs, Medicare savings plans, long-term care coverage, and explain what Medicare dual special needs plans are. My goal is to bring all these pieces together to help you understand the various aspects of your coverage. Hello everyone, my name is Micah and I am a licensed independent insurance broker. My team and I work nationwide supporting seniors and Medicare beneficiaries and finding the perfect Medicare coverage for them. Having personally worked with hundreds of dual eligible individuals, I wanted to clarify some of the most commonly misunderstood aspects about their coverage. So let's start with the basics. Medicare is a federal health program for people 65 and over, individuals who have received 24 months of Social Security disability payments, and those with certain diseases like end-stage renal disease. On the other hand, Medicaid is a state program for individuals with low incomes, with each state having its own criteria for eligibility. Medicaid comes in many shapes and forms with all sorts of confusing acronyms, but for simplicity in this video, we're discussing full Medicaid, which means when you see your doctor, you pay zero. There are also many forms of partial Medicaid where you could have a spend down before coverage begins or just get help paying your Part B premium. When you have both Medicaid and Medicare, you're known as what's called dual eligible, meaning that both Medicare and Medicaid contribute to paying your medical costs. Medicare always pays first and is your primary payer. When you go to the doctor, Medicare will pay the first 80% of your bill. Medicaid then pays the remaining 20% and you pay zero. Medicaid will also pay your co-pays and deductible when you go to the hospital or use your Medicare Part A services. If you're on a Medicare Advantage plan and have Medicaid, Medicaid will cover your Medicare Advantage plan's co-pays and co-insurances. In almost all states, your Medicaid will be set up as some type of managed care plan to provide your services. This means that your Medicaid has a network of doctors that accept it. For Medicaid to pay your Medicare co-pays and co-insurances, your provider needs to accept your Medicaid plan and be in network. Now, if you have received a bill for your Medicare co-insurance from a provider that is in network with your Medicaid, and you have full Medicaid in your state, this is a very common billing error. 80% of the time you can fix this by calling the billing department at your provider's office and making sure that they have your Medicaid information on file. As a dual eligible individual, you should automatically be enrolled in extra help for prescription drugs, also known as Low-Income Subsidy. This is a federal program that subsidizes drug costs for low-income Medicare beneficiaries. Even if you don't qualify for Medicaid, you might still qualify for extra help. You can check if you qualify for extra help by going to ssa.gov/Medicare/Part D extra help. You can also call Social Security and apply over the phone or request an application mailed to you. An online application takes around 10 minutes to complete. With extra help, you do not pay the deductible for your Medicare Part D prescription drug plan, you're not subject to the coverage gap, and if you have a Part D late enrollment penalty, it's waived. You'll receive a special enrollment period to change your Medicare Part D or Medicare Advantage plan outside of the annual enrollment period, and extra help will pay a monthly amount towards your Medicare Part D or Medicare Advantage plan premium, which may cover some or all of these costs. In most states, if you have full Medicaid and most forms of partial Medicaid, you should be automatically enrolled into a Medicare savings program. This program can pay your Part B premium and the money is deposited back into your Social Security check. If you think you might be eligible for a Medicare savings plan and you're still paying your Part D premium, you should contact your local DHS or Human Services office and check your eligibility or apply. Now let's talk about long-term care, which is a crucial topic for many people as they plan for the future. One important thing to understand is that Medicare does not cover long-term care. Medicare may cover short-term stays in a skilled nursing facility, but this is limited to a specific number of days and only after a qualifying hospital stay. Medicare does not cover custodial care, which includes help with daily activities such as bathing, dressing, eating. These are core services provided in long-term care settings. In contrast, Medicaid does provide coverage for long-term care. This includes nursing home care as well as home health and community-based services for those who qualify. If this is something you're researching, it may be helpful to contact a Medicaid estate planning attorney. Now, each state has its own rules, and you should contact an attorney licensed in your state. Lastly, if you have both Medicare and Medicaid, you might be eligible for a Medicare Dual Special Needs Plan in your area. To be eligible for these plans, you need to be enrolled in Medicare Parts A and B, live in the plan's service area, and have a qualifying level of Medicaid. These are Medicare Advantage plans designed to coordinate with your state Medicaid coverage. Because they take into account that your medical costs are being split between Medicare and Medicaid, they generally have more money to put towards comprehensive benefits that are not covered by Medicare and Medicaid. These additional benefits can sometimes have a profound impact on an individual's quality of life. It's important to understand that enrolling in one of these plans has no impact on your Medicaid eligibility. What you're doing is electing to receive your Medicare benefits from an insurance company's Medicare Advantage plan that is designed to coordinate with your existing Medicaid coverage. If you think you might be eligible for one of these plans, you should reach out to a licensed professional that has experience with this type of coverage, or you can reach out to your state SHIP agency. You should research your options and know that these types of plans don't work for everyone. Thank you for watching. I hope this video helped clarify how Medicare and Medicaid work together to cover your medical expenses. We covered a lot, from extra help with prescription drugs to Medicare savings plans, long-term care coverage, and Medicare Dual Special Needs plans. My goal was to bring all the pieces together so you can better understand the various aspects of your coverage. If you have any questions or need further assistance, feel free to reach out. Remember, my team and I are here to support you in navigating your Medicare and your Medicaid benefits. Don't forget to like and subscribe and share this video with anyone who might find it useful. Thanks again for tuning in, and we'll see you in the next one.